Good morning, everybody. Good to see you all. Thanks for joining us today. As you're probably aware, our numbers are increasing again and continue to be a cause for concern. And we just have to remember that the power to keep COVID-19 from getting more people sick in our county and in our region state is really under our control. We just need to continue to wear masks, maintain social distance, and keep our social circles small so we can push the curve back down, and we will do so, and with everybody's assistance. So thank you. We all continue to hope for a vaccine, but the information we have that at best one would not likely be generally available until probably next summer, spring or summer at best. So that is some time yet that we just need to really keep practicing our protective measures, as I mentioned. So we just need to keep doing all we can here locally. So we get questions about our response to COVID-19 and how we've used our CARES Act funding. I've got to say I'm incredibly proud of our partnership with the Snohomish Health District and the Snohomish County Council. We have, from day one, have been unified in our goals, which are protecting the health of the public, saving lives, and reducing the burden on our healthcare system. And we've also really focused on providing programs to help those in need, whether it's a business, a nonprofit organization, or our most vulnerable residents. So thank you for that partnership, and it's been strong here in Snohomish County. So COVID-19 may be with us for another year or more, and we just really need to be prepared for sustaining our response. We can't also count on another round of support from the federal government, but we'll continue to do all we can with the resources we have here locally. So with that, I'd like to just turn it over to Jason Biermann, who's the Director of the Department of Emergency Management, Snohomish County. Jason.
Thanks, Executive Summers. Good morning, everyone. Jason Biermann, the Director of Emergency Management. I just wanted to talk about a couple of the key things that we are doing here from the Emergency Coordination Center with the CARES Act funding and how incredibly important it is. And I also want to highlight, I'm not going to touch upon the Health District's work, but I know Shawn and Chair of the Health District, Wright, will do that very well. But also wanted to reiterate the great partnership we've had with the Health District. Our efforts here really focus on achieving the things outlined in the governor's Safe Start plan and ensuring that we're taking care of the most vulnerable folks, addressing things like food security, and ensuring that there's personal protective equipment for our first responders, healthcare workers, and the other folks who are in direct contact with people who have COVID-19. So some of the specifics I will mention with the CARES Act funding we received. And again, express some gratitude to the County Council for the appropriation that we received to address public health and the emergency response. We have, with the CARES Act funding, procured on the order of 20 million pieces of personal protective equipment. That number is based upon what we call burn rates, which is essentially how quickly our responders and healthcare providers use that type of equipment. So there actually is a model that we use and another that we use to check on how much PPE we project that we'll need. We use that to forecast how much of the equipment we should have on hand. And we work closely with local partners in the healthcare systems, in the fire EMS community and the law enforcement community, as well as long-term care facilities and school districts to make sure that we're working to ensure they have the personal protective equipment they need to protect themselves. We've also utilized some funding from CARES Act to provide food security through a program we call Nourishing Neighborhoods. Using that funding, we have actually gone to local farmers and worked with other food providers to provide food to our most at-risk neighborhoods, currently in 14 different locations, and we're working on expanding that to 22 separate locations around the county. We utilize a formula that takes into account income, the need for assistance with housing, as well as transportation and mobility data to identify where the most at-risk populations are, and those that are least likely to be able to access food through food banks and our other great supporters who help provide food security, and are now working in 22 different, will be working in 22 different locations to make sure food gets out to those folks who have challenges getting to food. We have also continued to run the isolation and quarantine facility. That facility is one of the things that's mandated under the governor's Safe Start plan as part of our move from phase 1 to phase 2 and under the current guidance. The facility, as many folks know, moved from downtown Everett out to the fairgrounds near Monroe. And we've been able to maintain that site successfully. It's been available when we've needed it for things such as the potential outbreak in the Everett Gospel Mission, when we were able to quickly move about 50 folks out to that site. And currently we're running typically between 5 and 10 folks a day, many of whom are coming in to ensure that they can get tested before they go and access other services that they need, primarily unsheltered folks who we need to make sure do not have COVID-19 before they access other services. So we've taken the model that we have. We've now made it available to use it for other purposes to ensure the health of folks who are providing other services for unsheltered folks. And we still have it there as both part of the governor's Safe Start plan and to ensure that if we do have an outbreak in either the unsheltered population or folks who just need another place to either isolate or quarantine, we have that available to them so that we can help protect the community by having that facility available. So with that, that's just some highlights of some of the things that we're doing here with our CARES Act funding. And with that, I would like to turn it over to Vice Chair of the County Council and Chair of the Health Board, Stephanie Wright.
Thank you, Jason, and good morning, everybody. So few people could have predicted the challenges that we faced this year. Businesses, nonprofit groups, healthcare systems, schools, childcares, faith-based organizations, neighborhoods, and families, they've all been impacted. And we've all had to rethink, retool, and regroup. So I hope you will join me in the immense pride that I have for our hardworking staff at the Snohomish Health District and the Department of Emergency Management as they have risen to challenge after challenge this year. Thrust into the national and global spotlight with the first confirmed case of COVID-19 in the United States way back in January, and now almost 9 months later, working with the same determination and passion for protecting the people of Snohomish County. Yet, even with these dedicated teams, it has been highlighted how precarious the public health system is locally, statewide, and nationally. Had it not been for the emergency allocations from our state legislature and the CARES Act money from the federal government, the Snohomish Health District would not have been able or had the capacity to maintain the sustained and complex response. With those funds, the district has been able to hire more than 60 temporary staff to do the contact tracing, testing, and communications necessary. These positions have also allowed some of our staff, our permanent staff, to resume their regular job functions. Right now, the Snohomish Health District is currently expending about $700,000 to $750,000 per month on the response. However, the emergency funding to support these temporary positions and the response efforts is set to expire in December. As the Board of Health Chair, I am aware of the Health District's funding situation. If we were to continue funding the response at the $700,000 to $750,000 per month level, we would drain the Health District's reserves before the end of 2021. This means we would have to eliminate most, if not all, of the temporary positions come January unless the CARES Act funding is extended for another year. Loss of these positions and funding would severely diminish our capacity to continue responding at the same level. Without the capacity to effectively track and investigate cases, to support testing efforts, and to work with our partners around the region, our communities, our businesses, schools, and children will pay the price. I'm calling on all of you, asking you to please reach out to your US senators, your representatives, to urge support of extending these critical CARES Act dollars. Thank you, I really appreciate your efforts. And right now, I'd like to turn it over to Shawn Frederick, the Health District's Administrative Officer.
Thank you, Chair Wright, and good morning, everyone. While Dr. Spitters is enjoying some well-deserved time off, he asked that I share a couple of updates with you. We're aware of a growing number of cases involving the Tulalip Boys and Girls Club. At this time, we know of at least 8 confirmed cases. Out of privacy of those involved, we won't be sharing any further details. We encourage anyone who may be concerned about possible exposure or was a close contact to seek testing. close contacts should remain at home for the full 14 days after their last possible exposure. The Snohomish Health District is working closely with Tulalip Tribes and Boys and Girls Club on the investigation, both of whom have excellent partners. As our most recent numbers show, COVID is still very much circulating through Snohomish County. Yesterday's published 2-week case count was nearly 72 per 100,000 as of October 10th. Our staff are inundated with reports of 50 to 70 new cases each day. And given this new case rate and how close it is to the 75 per 100,000 threshold for high risk in the Department of Health decision tree for schools, Dr. Spitters did have guidance that was shared with the schools yesterday. He's asked that all schools hold where they're currently at. They don't need to move backwards if they've started to bring special needs students in K through 3 grades back, but they shouldn't bring any additional students in at this time. We'll monitor daily case counts this week and see what next Monday's new case rate is, and then talk with the schools again during our bi-weekly call next Tuesday on October 20th. The majority of our new cases are the result of too many people in closed settings, especially without face coverings. A reminder, we're relying on everyone to do their part to stay home if they're sick, limit gatherings and people with people outside the household, and to mask up. Now I'll turn it back to Executive Summers for questions.
Okay, if you have any questions, go ahead and submit them in the chat, please. Okay, first question. Snohomish County has been in the same phase for months. What do you attribute rise in cases to, and what's the concern moving forward? Shawn, do you want to address that?
Sure, Executive Summers. The closest thing we can attribute it to is really, as we have gone through these several months, there have been a few holidays, and what we've seen is increased gatherings with people who are not within the same household. And as we get into the cooler months and we continue to see more and more congregate settings, you know, there's a good chance if we're not maintaining good social distancing when we're in those environments, if we're not masking up, that those cases may continue to increase.
Okay, the next question, in addition to the facility at the Monroe Fairgrounds, do you have other facilities you can use for emergency cold weather shelters that could be made COVID safe with distancing, proper ventilation? Maybe Jason, I know you've been working on cold weather sheltering. I'll turn it over to you.
Yeah, thanks, Dave. So right now, yes, we have been planning for cold weather sheltering. There is a facility in Monroe or near Monroe that we're planning as a cold weather site. It is not the same place. It's not the isolation and quarantine site itself. And then another site in South County that we're working with our partners. One of the things that we've already planned, and I believe they're actually doing this this week, is to actually have staff from the isolation and quarantine site, as well as staff from the health district, who will be going out to do an assessment of these facilities and make sure that they are as COVID safe as possible, and that we share some best practices from them with what we've done at the isolation and quarantine facility, as well as get the input from the health district on ensuring that folks are as safe as possible in those cold weather facilities.
Shawn or Stephanie, you have anything to add on cold weather shelters? Okay.
No, I just know that we've been working with DEM very closely, and I appreciate their support on this issue.
No, Jason is correct. The initial meeting actually starts this week, and there's some walkthroughs that are scheduled in the coming weeks with the cold weather shelters to make sure everything is as we expect.
Also, just add that we've convened providers, the cities, the county, and others, nonprofits, to discuss our sheltering needs, not only cold weather shelters, but sheltering throughout the year. And we're really working hard to better coordinate our efforts. So we have need for sheltering that far exceeds the availability. So we recognize it as a particular challenge going forward, since we have to have social distancing in place at their shelters, so it cuts down the capacity that we've even had in the past. So we are working on that with our providers, and we most recently, the cold weather shelter in Monroe, been working with the city of Monroe, as Jason mentioned. So it is a concern, but the team's on it. Let's see. Next question. Do you know how Snohomish County rise in cases compares to other counties? Is there a particular concern here? And actually I skipped over one. I'll go back to it in a minute, but do we know how we compare to other counties?
I know Pierce County has been rising in the last few weeks, I think very similar to Snohomish County, but I defer to Jason or Shawn about information on King County.
I'm not aware specifically of King County, but Pierce County has generally been experiencing an increase in cases. And yeah, Pierce County has. I really can't speak to King County or Skagit for that matter.
Okay, and there was a prior question. The outbreaks reported this week show higher infections than were previously seen. Will we be getting more information about those other outbreaks? So you mentioned the one at Tulalip Boys and Girls Club. Are there other outbreaks that we're aware of that are sort of centralized?
So what I can say is that in next week's weekly update on Monday, it's going to take some time to do all of the investigations and follow up as part of any outbreak. So it's something we can talk to in next week's briefing.
Okay, with school districts being asked to pause their reopening and cases continuing to rise, how likely is it that schools will get to stay open at all? Do we have any insight into that? No, I think we'll have to come back to that next week, but obviously with cases rising, and it's it seems quite evident that people congregating indoors in larger groups is just going to be a problem. So although the health officer has been talking with the schools, I'm not really familiar with what the future plans are, but I'd say the trend is very concerning. So another question, and I want to clarify what Stephanie Wright said earlier. It sounds like without a new CARES Act deal in Congress, Snohomish County will have to make cuts starting in January. Stephanie, I think you were talking about the health district, but do you want to clarify that?
Correct. That was cuts to the health district's temporary staffing for the contact tracing and communications from those CARES Act. And we don't want to cut positions. We're trying to be proactive. So if we can reach out to Congress and get those CARES Act dollars extended past that deadline or additional dollars. So that's why we're trying to start that conversation now, while we still have 3 months to plan and figure out a different solution, just because we see those services as vital to Snohomish County and our response.
So the CARES Act dollars that we received, the first round, were distributed. A good portion was given to the health district for their activities, contact tracing, testing, etc. But also that's what we use to stand up our small business and business program, rent relief and other activities, the PPE purchases that Jason mentioned. So they've been really critical. Those dollars from Congress have been really critical in helping us respond. So I think we have a general concern that if there are not future allocations of dollars and this drags out for quite some time, we're all going to be having difficulty maintaining the programs that we've been able to stand up to date. So is there any indication what the flu season is shaping up to look like yet? and as a follow-up to Simone's question, what would be the impact to the county's COVID response if you do have to make cuts? Shawn, do you have any insights into the flu season?
Not yet. I know that it's something that Dr. Spitters has been following overseas. Is obviously they're in a different season than we are, and that'll be a great question for him once he returns next week, and make sure that we follow up on that.
But we are encouraging everybody to get their flu shot this year, just to be proactive.
And Shawn, do you mind, part of, I didn't mention earlier, part of what we're doing here in the Emergency Coordination Center is a lot of planning around both the flu season and upcoming vaccinations. So there's communication among responders and others about the importance of that. So I think to Chair Wright's point, there's certainly a lot of messaging going out about the need to get a flu shot this year, and a lot of work being done around planning for vaccinations.
And a lot of that message is being done with lots of partners, not just here locally in Snohomish County, but also regionally at the state level.
And washing your hands, social distance, and those masks, they help ward off flu just like COVID-19. So keep up those good habits, please.
So Jason, there was a follow-up question about if we do not receive further dollars, what the impact might be. I know we're well stocked with PPE probably through the end of the year, but things like the cold weather, not the cold weather shelter, but the isolation quarantine center at Monroe, that's also funded with CARES Act dollars, and those will run out at the end of the year. Any thoughts about what happens if we don't get further dollars?
Yeah, I mean, it's the impacts are pretty significant. The isolation and quarantine facility, we would have to retool and change significantly. We would have to look at the other programs, such as providing the food that we are through Nourishing Neighborhoods, because that's funded with CARES Act dollars. The assistance we're providing for daycare for essential workers, that's funded as well with CARES Act dollars. And then as Shawn and Chair Wright both mentioned, the activities the health district's doing. So there will be profound impacts to our response kind of across the board with everything we've been doing to support the community.
Yeah,
in that body of work, it's our testing, it's the contact tracers, the additional case investigators we brought on board. But it's also those teams that we have working with our employers and schools to quickly handle cases to keep people as operational as possible.
Just add that we do not have the financial capacity at the county level to continue many of these programs that we've been doing this year, PPE purchases, grant programs for businesses and individuals, contact tracing, testing, quarantine, and isolation site. Those are all really have been made possible with the federal funding, and without continued federal funding, as Jason mentioned, a lot of those programs would either have to be significantly curtailed or even eliminated. So it's of great concern. Let's see, is there any correlation between the increase in testing and the increase in daily cases?
No. We expect to see, the increase in daily cases is a reflection of an increase in the positivity rate of the number of cases, not the number of tests that are being done themselves. Ideally, what we'd like to see as we continue to do more testing is actually see that positivity rate go down, which is a good signal to us that we are seeing decreased transmission of COVID throughout our communities. While we're seeing this increased number of positive cases and this increased positivity rate, it gives us an indication that we're seeing increased transmission of COVID through our community.
go back to a question I jumped over. Are we asking, oh, the screen just jumped. Are we asking the state to access reserves to help weather this? Well, we do talk with the governor's office almost daily, and also our state legislative delegation. I think my concern is that this is a statewide problem, and they would be extremely difficult for the state to pick up all the programs that we've been doing and funding through the CARES Act dollars. So we will continue to work with them and ask for what assistance we can. They have been good partners, but I do not see the capacity at the state level to continue these programs. We will certainly ask and try to do as much as we can. But I don't know, Jason, do you have any insight into at your level working with the state?
No, I think you covered it well. I think they're looking as well as we are at solutions once their CARES Act funds go away as well. So I think it's a struggle across the state as well.
Hey, if the case trend continues, should people be preparing for the possibility we have to go back to full stay home mode like we were in late March or April? Shawn, I'll pass that to you.
Okay. You know, rather than prepare for another stay home period, it'd really be a better use of everyone's energy if we limit our social gatherings now and mask up, practice good social distancing so we don't have to. We absolutely have the ability to control this with our individual efforts. So that's what I would encourage everyone to do.
Yeah, I'd have to say that it would have to get pretty severe, but so we have not been talking about going back to full stay-at-home mode. But you know, I think anything's possible depending on how severe this next peak is and how we're doing with hospitalizations and deaths. So, you know, I think all the tools we have in the toolbox are still available, but that's not where we want to go. And frankly, people need to, even when they're home and inside, need to be practicing caution and safety measures, because that's actually a cause for concern, is people being inside and confined. So we'll just have to see how it goes here and consult the experts. Where do hospitalizations due to COVID stand? I know as this case count has risen, hospitalizations have risen also. Do we know exactly where we stand, Shawn?
So hospitalizations have increased slightly during the last 2-week period. They're still very stable, but of course we're monitoring that on a regular basis. At any given point, we have about 20 Snohomish County residents that may be hospitalized, you know, either within Snohomish County or in hospitals outside of Snohomish County.
Thank you. I think that wraps us up.
Thank you, everyone. This is Carrie in the Joint Information Center. I appreciate you all joining us this morning, and please do stay tuned for future media availabilities. Thanks.